Hi there. So now we're going to do the tests for the calcaneofibular ligament. That's the one that goes straight down. So we're going to be stressing it by separating these two bones, by separating the lateral malleolus from the calcaneus over here. So we're going to be in the same position we were in when we did the other demonstration for the anterior talofibular ligament last week. So here you're holding with the fingers on the heel, but now you're going to keep it into dorsiflexion. The function of the opposite hand is to keep the foot in dorsiflexion because you can't really stress this ligament unless you're fully in dorsiflexion, or at least not efficiently. So here we got the foot in dorsiflexion. My fingers are going to do the work. This hand on top just supports it in dorsiflexion, and I'm going to turn the foot this way. So here I'm bringing these two things farther apart from each other, and this forefoot is just following along. And then you do, if it doesn't hurt, do a little bit of an overpressure. So if it's painful, it'll be painful somewhere along this line, from here under the lateral malleolus right down to the calcaneus. It usually gets injured there, right underneath, but it can be in the midline or the bottom or the entire thing. So let's do it one more time. So you take it into dorsiflexion, your fingers do the work on this hand, and you take it and you do a little overpressure. Then you do dorsiflexion to check for inflammation in the ankle by seeing if there's any swelling, and doing plantar flexion and dorsiflexion tell you if there's swelling. So if there was swelling, I'd get to here and the person said, whoa, they say it hurt. Or instead of getting all the way here, I'd just get to there and it would say, wow, that's hurting. Or you'll feel a resistance, a kind of spongy resistance. And of course you always do the heat test. You use the back of your hand and you check one foot and the other foot just very gently to see, and you might do it on the outside, even though the swelling will be throughout the lateral section. It doesn't matter which ligament is injured. So again, we have these different tests. We have heat to start with, then we have inversion and dorsiflexion here, and you give it a little overpressure. We do passive dorsiflexion, the person relaxes, you do a little overpressure, and then plantar flexion, and again only as far as they can go easily, and then a little overpressure. And when somebody has a little tiny bit of swelling that you really don't see, what they're going to feel is when you do these two movements, it's going to be painful a little tiny bit at the end, because that's when you get to the fluid in there affecting the motion of the joint at the very end of the motion. So that's it for the lateral ligament, the calcaneofibular ligament.